Assalamu alaikum. Today we are going to discuss about the management of the miscarriages. Threatened miscarriage. If a patient comes with the bleeding and there is an alive intrauterine pregnancy, this is a threatened miscarriage. So what will you do? You will admit this patient, you will advise bed rest, you will give supportive treatment, you will arrange peace counseling, and you will keep this patient under observation. And if bleeding stops after 20 if patient remains bleeding for 24 hours, you can discharge this patient with follow-up if there is any again episode of the bleeding. Inevitable miscarriage, it has the same treatment, but in this case, as the cervical os is open, the pregnancy is unable to continue, so you have to counsel this patient that this pregnancy is at risk. So this is inevitable miscarriage and threatened miscarriage. Incomplete miscarriage, if a patient is stable, in this case you will go for the medical treatment, and we are not going into the details of the medical treatment. You will give misoprostol, and the doses of these misoprostol we will cover in our another video. And unstable miscarriage, you will go for the dilatation and curettage. If there is complete miscarriage, if a patient has bleeding and then if patient had bleeding and that has stopped and products of conception has been expelled, you just keep this patient under observation and repeat pregnancy test after 21 days. Missed miscarriage. Miscarriage, in this case there are two modes of the treatment: medical treatment and surgical treatment. If medical treatment, you give misoprostol, and the doses of misoprostol are different according to the gestational age. And surgical treatment is the dilatation and curettage. And we are not going into the details of the recurrent miscarriages because it has it needs wide range of investigations, consultant, gynecologist management, and different medications to stop the miscarriages. So this is beyond the scope of our this video. I hope you will understand and you will be able to answer questions in an interview or in a viva.